past few weeks when I have joined you, sort of felt a little bit like there wasn't that much new to say, right? I mean, we had an election and we talked about that. And we'll talk more about that as the year goes on and what changes that might bring. But now, after months of COVID cases staying pretty steady and being relatively low, we've had a real uptick in cases. From what I'm reading, the experts seem to think that Halloween has something to do with that. Indoor gatherings, even just the smallish indoor gatherings that we have in our homes may have something to do with that. But in reaction, we've seen new restrictions, Philadelphia, New Jersey, I'll talk about Pennsylvania also in a minute. So most of the restrictions in Philadelphia are based around restaurants, retail. There also is a request it's part of the guidance that if you had started bringing people back to work, if they can work from home, let's have them work from home again. And that's probably good advice for all of us. Something to think about. I know a lot of us were rejoicing in the idea of getting back into our offices to be more collaborative, to see our colleagues. But I think this is a time where if you can have people work from home, if they can be as productive from home, have them work from home even part of the week. And as far as Pennsylvania goes, nothing new as far as restrictions for businesses, but we did see in Montgomery County, if we did see a guidance in Montgomery County from the Department of Health that for 2 weeks, the 2 weeks that buffer Thanksgiving, all schools are going to go virtual, public, private, Catholic. So, and that is a prophylactic attempt to keep the spread down. So we'll see what happens beyond that. So as far as New Jersey goes, the Executive Order 192 came out a couple of weeks ago, took a lot of this stuff, I think, is stuff you probably should have been doing and were doing anyway, but certainly mandates around masks, around social distancing. If you didn't have hand sanitizer for your folks before, make sure you have it now. It is much more readily available now than it was back in the spring. Take breaks for hand hygiene. I think we've all been in retail establishments. Wegmans is a good example. They will tell their employees, if you're not interacting with a customer right at the second, take 2 minutes, go wash your hands, practice good hand hygiene. Cleaning and disinfection, DOH and CDC has guidelines around this. And your daily health checks. If you haven't been doing this already, it's a good idea. If nothing else, it kind of keeps your employees honest. So that they're thinking about their symptoms, they're thinking about temperature, and then that they're not going to come to work if they're experiencing any of these symptoms. Obviously, you want to exclude employees from the workplace and promptly notify employees if there is a known exposure to COVID at the work site. We're getting a couple of questions in about what to do if you have a positive case. I am going to cover that today. And keep in mind, I've said this before, I'll say it again. If you haven't spent any time on the CDC's website lately, spend 5 or 10 minutes. It really is a good idea. So just to go over this, and keep in mind this stuff changes, okay? So again, a good reason maybe every week or so to go on a CDC's website, but this is the current guidance. What do you do as an employer if an employee has a confirmed or a suspected case of COVID? Okay, first of all, CDC's got cleaning and disinfection recommendations. You can go on the CDC's website to get the details around that. There are a lot of good cleaning companies in the area who are pretty well versed in this stuff by now if you want to bring somebody in from the outside to do this for you. And then contact tracing, okay? This is why it's important to kind of know where your employees are on a daily basis, on a regular basis, on a shift basis. You need to determine which employees may have been exposed to the virus. How do you do that? You have to determine close contact. Close contact is defined as about 10 to 15 minutes or more in a 24-hour period within 6 feet of someone else with or without masks, okay? So figure out who those folks are who may have been in close contact. Keep in mind your ADA confidentiality requirements. You don't have to tell the employees who in the workplace has the confirmed or suspected case, but tell them they may have been exposed. CDC again has guidelines around this, that these people need to be monitoring themselves for symptoms, okay? If you do have a confirmed or suspected case of COVID-19, that person should be excluded from work. If the employee tested positive for COVID, they should be excluded from work, isolated home, or obviously if they need to be hospitalized, go to the hospital. For most employers, and that's not critical infrastructure, that's not healthcare, but for most workers, most employers, instruct the potentially exposed employees to stay home for 14 days, telework if possible, and again, self-monitor for symptoms. And then employees who think or know they had COVID-19 and had symptoms can be around others. This is when they can end their home isolation, 10 days since the first symptoms appeared, and 24 hours with no fever, without fever-reducing medications, and their other symptoms are improving. And the CDC recognizes there are a couple of symptoms, loss of taste or smell in particular, that may linger for months. So really, if the other stuff is improving. Employees who test positive but have no symptoms can be with others after 10 days since a positive viral test, and that's people who are purely asymptomatic. FFCRA, I saw a question, somebody chatted in this question as well. So as we're talking about all this good stuff to do with employees, right? When they've been exposed, what about FFCRA? What about time off, paid time off, or otherwise? So FFCRA is set to expire December 31st, 2020. This is for employers with less than 500 employees. We're probably at a point in the year where a lot of employees have burned through their FFCRA time, but probably not everyone. So keep in mind there are 10 days. Generally speaking, that's about 80 hours. But if you have an employee with a variable schedule, that may change, and we can help you think through that issue. They can, if they can't work for these 6 enumerated reasons, they get partial pay time off. Okay, if they're subject to a quarantine order, if they've been advised by a healthcare provider to self-quarantine, if they're experiencing symptoms and they're seeking a diagnosis, if they're caring for someone who is subject to quarantine, or then the school issue. That number 6, we still don't know what that one means. Stay tuned, who knows, maybe DOL will tell us. The 5th one is around school, and then yes, you can get additional time if you're caring for school-age children who are not in school. And those are school-age children who are not in school because they can't be in school. It's not that you chose a virtual option when you had an in-person option, it's that the individuals are not in school. So again, we're probably at a point where a lot of employees have burned through this time. And people are asking, do you think that FFCRA will be extended? I tend to think yes. I haven't read anything definitive around that, so don't hold me to it. But I find it hard to imagine that, you know, we're at a point in the pandemic where cases are rising, where we're not seeing an end. We're seeing a little bit of a light at the end of the tunnel. I'll talk about that in a minute, but I don't think we're going to see any real change for several months. So I would be surprised if FFCRA is not extended. I'm also hoping they fix it a little bit because I think there are some issues with it. So I'm hoping that they do fix it. But keep in mind, yes, if employees can work remotely, they still should be able to work remotely unless they have a physician saying they can't, that they're so sick that they're unable to actually work remotely. So keep that in mind as well. So FFCRA is for folks who can't work remotely. Okay, so what about travel? I haven't talked about this since the summer. Okay, remember, you as the employer remain responsible for providing a safe working environment. And that includes business travel. That includes getting on a plane. That includes whatever destination you send your folks to. That includes if they're driving in a car, and it's a far enough distance, they're going to have to stop along the way. So think about, where's the employee going? How are they getting there? Am I confident that the customer or client site that I'm sending them to is a safe place? Here at MEA, if we are still going out and doing some live training. We've got members who are, for example, manufacturing, who are live. I've gone out to workplaces, I've done training, but ahead of time I call. In Pennsylvania, we have to have a pandemic safety officer. I'm the pandemic safety officer for MEA. I will call the pandemic safety officer or whoever is in charge of safety and health at the member, and we'll talk through what are they doing around masking and social distancing and cleaning and hand sanitizer, and am I confident that we're sending our trainers into a safe workplace? So that's all things you have to think about from a business travel point of view. Have a personal travel. We talked about this in the summer. Of course, when we talked about this in the summer, I think there were about 15 Pennsylvania quarantine states. Now there's about 40, okay? And if you want to get a list of the Pennsylvania quarantine states, New Jersey quarantine states, whatever state you're in, just Google Pennsylvania quarantine states or New Jersey quarantine states. It should pop up. Whenever I do that, it's my first listing. And you'll be surprised at how many states are on the quarantine list for Pennsylvania and New Jersey. Keep in mind that, so if you are in person, you have people coming to work every day. I know there's been some concern, our office is real close to the border of Delaware, or we're right across the river from New Jersey. So we have employees coming from states that have high cases right now. There is an exception in there, at least in Pennsylvania, recognizing that it's not practical to limit travel from any bordering states. So New Jersey, I'm going to get this wrong, New Jersey, Delaware, New York, Ohio, right? So it's not realistic to say that people can't come across the border from those states that they would have to quarantine. But certainly we all should be trying to keep our travel to a minimum right now. And so for employers, if you haven't done it already, if you didn't do it in the summer, think about it now for the holidays. Telling your employees if they do travel to any of these other states, if they go to Florida for the holidays, if they go to some of these other quarantine states for the holidays, that you're going to expect them to quarantine when they come back. You're going to expect them not to set foot in your workplace when they come back. And then think about, do you have to pay them while they're quarantining? It doesn't seem that FFCRA covers that issue, because at least in Pennsylvania, the quarantining is a guidance. It's not an order. So it appears that FFCRA does not cover that. But what are you going to do as an employer to make sure that people actually do stay home, that people actually are responsible? The best way, obviously, to do it is to pay them while they're home. Or if they can work from home, great. That will do it as well. But things to think about right now, because holiday travel is just about upon us. And then, like I said before, good news on the vaccine front. I think we're all starting to see way off in the distance a little bit, but there is a light at the end of this tunnel. Just in the last week or so, Pfizer and Moderna have announced promising data regarding their vaccines, over 90% effectiveness. And there is, what I'm reading is that vulnerable populations could be receiving vaccines as soon as the end of this year. When we talk about vulnerable populations, that's healthcare workers, that's older citizens. I would think prison populations and the military would be first in line as well. But then for the rest of us, the hope is that the vaccine could be more widely available, maybe spring of 2021. And that's when we're talking about maybe getting back to some semblance of normalcy. And we've talked about this before, but now that this is looking like this is something to think about, can we require as an employer the COVID vaccine when it becomes available? So this has always been an issue, or has sometimes been an issue, around flu vaccines. Generally speaking, as an employer, you can establish legitimate health and safety requirements as long as they're job related and consistent with business necessity. Most employers have chosen not to do that around the flu shot for a number of reasons, but part of it is sort of this carrot stick thing. It's great to provide carrots to make sure that people can get their shots, but what's the stick? Are you really going to fire people if they refuse to get a flu shot? And keep in mind also, and in this case, a COVID shot, but keep in mind also, no matter what you do, even if you do try to mandate, you have to allow for reasonable accommodation, interactive process on the basis of disability and or religion. So if you are thinking about mandating COVID vaccines and you're not in healthcare, definitely talk to an employment attorney. Members can reach out to member legal services, but that's something to really think about whether or not it makes sense for your organization. So I did see a bunch of questions come through. So someone asked, any recommendations for employers with employees who have relatives coming to live with them over the holidays from states on PA's quarantine list? It's a great question. I have always been hesitant to try to police our employees too much in indirect ways. I was getting these calls a few months ago. We know we have a person, one of our cleaning people cleans at a healthcare or at a nursing home on the weekends, or one of our employees works retail on the weekends. What do we do? At some level, we've got to trust our employees to do the right thing, right? Because in that case, you've got relatives coming from a quarantine state. The obligation is on those relatives to quarantine. And it is possible to quarantine in the same house, right? You can isolate yourself, you can wear masks, that is possible. Now, you may want as an employer to have a conversation with those employees, people who are sharing that information. Can they work from home? And maybe you tell them, okay, why don't you work from home for 14 days while your relatives are there? Maybe that's a solution, but we have to get a little bit, I think we need to balance as employers. I am 100% all for safety, and doing everything we can within the law to try to keep our workplaces safe. But I also think that we need to be careful, because what ends up happening is that the employees who share information from us get treated one way, and the employees who don't tell us anything might end up getting treated a different way because they're just being more cagey about it. So I really think something to think about. If an employer does not require a vaccination, can an employee refuse to come back to the office due to safety risks? Interesting question. I would tend to think not. Because I think there's so much that goes into the employer's decision about whether or not to mandate vaccines. And I think it's going to be very hard for employers to mandate vaccines if you're non-healthcare, especially, and certainly if you don't deal directly with the public. But it will be an interesting question, and I'm not giving a definitive answer on that, but stay tuned. The employer's obligation to provide a safe workplace is not going away.
Amy, this is Kevin. One question for you, and I might have missed it, so apologize. So I think you outlined what happens when an employee tests positive for the time period out. When you've gone through the contact tracing, you have identified some employees that have to be quarantined. What are the? Yeah,
I'm going to go back to the slide.
Yeah.
So. So when you contact trace, obviously you want to, if you have employees in close contact, you want to inform them, and then obviously maintain your confidentiality. Only the people who test positive should be excluded from work. Potentially exposed employees also should stay home for 14 days. So you've got your positive cases, you've got your exposed cases. You want those folks to stay home for a period of time. Telework if at all possible.
So it's still the 14 days. There's nothing that says if you wait 5 days and 2 negative tests or anything at this point on the quarantine.
Yeah, CDC. Quarantine. Yeah, CDC has really shied away from this idea of getting a negative test, because I think what we're learning is the tests are not super reliable, and also they may not catch you at the right moment. So I could have been exposed yesterday. If I test today, I could have gotten exposed yesterday and actually gotten COVID. If I get tested today, probably not going to test positive. If I test for the next several days, probably not going to test positive. So I think that's where the CDC hesitates to rely too much on testing as opposed to simply quarantining.
Yeah, so I think what that tells us, to the extent possible, you really want your internal procedures to avoid close contact with or without masks, because that quarantine is really the major thing. So I think you've just got to keep very vigilant as people are back at work, especially if it's a place production where you have to have people there. And I know a lot of members I've spoken to are, do building, don't let people go building to building and that type of thing, but you really just kind of want to try to avoid that direct contact.
Yeah, and most of our members that, like I said, I've been out to several work sites now, doing some training with a lot of manufacturers. I think a lot of companies have gotten really good about this, really creative about this, and they've really thought this through. But yeah, the idea really is keep people as far away from each other as you possibly can. Everybody's wearing their masks, but to the extent you can keep people far away from each other, that's going to be your best bet to avoid, first of all, an outbreak in your workplace, but also to avoid having to send people home to quarantine.
Yeah. And one final question, someone with a location in Texas said, how much of this applies? And like you've said, CDC is the primary, that covers everybody, and each state has a little bit different, but, I think most of what you said, I think would be sound policies regardless of where you are.
Yeah, the shutdown type stuff tends to be local, but the guidance around what you do with an exposure, the guidance around what you do with people who test positive, that's national. It's CDC recommendation, but certainly as an employer, since we have an obligation to provide a safe workplace, and we don't want an outbreak in our facility, if you follow CDC guidance, you're going to be in pretty good shape.
Yeah, and if you are an MEA member, and if you haven't taken advantage of it, we do have a templated safety plan, which is primarily founded on the CDC principles. We do have, riders or add-ons for the states in our region, but that's a great starting point if you are a member to act. So if you haven't accessed that, you can find it on our member site or give a call to the hotline.
Absolutely, and as always, a recording of this webinar and copies of our slides will be made available after the presentation.
Yeah. All right. Well, thank you. We ran a little over, but a lot to cover today. So we hope everybody enjoys their Thanksgiving in a very safe way, which will be very different for all of us this year. But a little short-term pain for the long-term is the right thing to do. And we will see you the following Tuesday. Take care. Thanks, Amy.
Take care, everybody.